Good morning, everyone. Just to confuse you, I'm not Flavia. My name's Meg. I'm a dietitian at Nestle. We're sponsoring the event this morning. And the reason that we are here this morning is because Nestle has a purpose to contribute to a healthier future and enable healthier and happier lives. And to do that, we've made a number of commitments around our products, around initiatives we have, but also in terms of building nutrition knowledge and science and sharing that with people. So the purpose of bringing here today, we've been working with Flavia at Nutrition Research Australia to do some analysis around the Australian Aussie kids diet. So we've looked at discretionary food research, we've looked at vegetables, and we've also done a focus on milk consumption. So Flavia is going to share some of those insights today, and then we've brought in Rivkeh from Dairy Australia to really share some of those consumer insights around what's kind of driving milk consumption in Australia. So I'll hand over to Flavia. If you have any questions, we've got plenty of time at the end, and there'll be some hot breakfast coming in around 10 or 15 minutes as well, so feel free to enjoy that. Thanks.
So good morning, everyone. First of all, I'd like to thank you so much for compromising your sleep to come listen to me talk. Myself, that has a 1-year-old, and anyone else in the room has the young babies, it's fine for us to wake up so early because I haven't woken up past 6 a.m. pretty much for the past year. But thank you for coming. You're really going to get something out of this presentation. So my goal is to give you practical recommendations that you can then take to your work or to your home and family on how you can actually improve diets of Australian kids that are evidence-based and completely based on research that we've done. So to give you a background of what we're going to be talking about today, I'll give you a background of what the situation is with kids' diets and why we actually investigated nutrition and diets of Australian kids. I'm going to talk about some methods, not in too much detail, but if you have any questions at the end, I can give you the nitty-gritty. I really wanted to keep it more practical and visual today. Then talk about 2 key areas in the diet of kids. So among Australians, milk and veggies are the 2 most under-consumed food groups. So I'm going to talk about those 2 food groups and give you recommendations as we go along based on the evidence, and then finish it off with what does it all mean and what can you take home in terms of recommendations. So as you've probably heard before, 1 in 4 Australian kids and adolescents are either overweight or obese. So it's a really big issue. We need to kind of determine, how does diet play a role in that obesity epidemic? What can we learn about what they're consuming and what the relationship is with diet and obesity? So one thing that we do know is that Australian kids are not consuming enough core foods. So the Australian Dietary Guidelines has certain recommendations for what kids should be eating, and there's an Australian Guide to Healthy Eating that gives you that visual proportion of what you should be eating for each of the 5 core food groups. But we know that more than 60% aren't meeting any one of those groups, with some, for veggies, for example, less than 1% are meeting it. And with dairy, it's about 20% that are meeting it. So it's a big issue because no one's eating according to the guidelines. So when you see all those fad diets and you say, this is the best one or this is the best one, well, if people actually ate according to the guidelines, then everyone would be much better off. But no one is actually eating according to the dietary guidelines. And it's the most evidence-based recommendation that we have. But at the same time, so if they're not eating, if no one's meeting those recommendations, then what are they eating? Well, over a third of the diet, so if you had 3 meals a day, 1 whole meal, actually more than 1 whole meal, is discretionary foods. So those are the foods that provide lots of enjoyment in our lives, but it's really not necessary in terms of a nutritional intake. So it's things like cakes, biscuits, chocolate, lollies, French fries, burgers, pies, butter, cream, ice cream, etc. So it's not surprising then, so the guidelines are set to minimize chronic disease, but also ensure that kids are getting enough nutrition for optimal growth. So if they're not eating, and no one's really meeting the guidelines, they're over-consuming discretionary foods, then it's not surprising that we have a nutrition shortfall. So more than 90% of adolescent girls and 70% of boys are not meeting their calcium targets at a time when their bones are depositing, and it's the most critical time for bone development. We also know that 60% of girls aren't consuming enough iron. And we also know at the same time, and it's not surprising given their very high discretionary intake, that over 60% of kids are exceeding the WHO guidelines for free sugars in their diet, which is less than 10%. So this is where it comes to what we've done. So we decided, let's look at the latest National Nutrition Survey, and not only just report on the things that I've just talked about, like how much they're having, but also deep dive into, what time are they having foods, when, with what are the top foods, and so on, to gain a real deep understanding of what we can do in terms of fixing this problem that we have. So the latest National Nutrition and Physical Activity Survey collected data from almost 3,000 kids. So these kids were representative of the Australian population, so from each state, the right proportion of males and females, socioeconomic status, and so on. So the methodology to collect a diet in this survey was a 24-hour recall, so 2 24-hour recalls. And a 24-hour recall, it's a very strict methodology. It's very methodological, the way that you obtain the diet information. It's computer assisted, and for younger kids, it's with the parent that you obtain information. And you probe in 24 hours, so from midnight to midnight, everything that they pretty much put in their mouth, including beverages, foods, so spreads, sugar that you add to your beverage or to your cereal. So everything is captured. And then, we get the raw data and we have fun with it, or at least I have fun with it, because I love numbers. So as part of that survey, when you collect information, one of the questions is you ask, what would you call the eating occasion? So right now, if I were to ask you, what would you call this eating occasion? So most people would say breakfast, but some people might call it a snack, or if you're just having coffee, you might call it beverage. So it's whatever the participants call the eating occasion. It's not related to time, and I'll be presenting some results later on eating occasions, so keep in mind that it's whatever the participant called it. And it's nice to have that information because then we can use the same terminology when making recommendations to change their diet. And then we did lots of fancy statistical analysis, like we adjusted for a lot of confounders like physical activity, weight, socioeconomic status, energy intake, for whatever was related for the outcome that we're looking at. Okay, so general linear models, and we set the p-value at less than 0.01. So this is what the Australian Guide to Healthy Eating looks like. I'm going to be talking about how many serves of the different food groups kids are eating. So to give you an idea what a serve looks like, the serves are the recommendations to meet those nutrient needs, right? So a serve is not necessarily equal to a portion for a lot of foods. So for vegetables, for example, a serve is 75 grams of vegetables. Pretty much none of the kids had 100% vegetable juice. It's like a few kids in the survey, so we can ignore that one for now. But it's really, half a medium potato. So if you have one potato, which really isn't a serve for most people, let's say 2 potatoes, then you've got 4 veggie serves, right? So when you think 5 serves a day, it's not really that much. A serve is not equal to a portion, and that's really important to keep in mind when we're talking about serves. So it's serves in the guideline that are meant to meet your nutrient needs. Then when you look at what a serve looks like for the yogurt, milk, cheese, and alternatives group, I'm going to be calling that dairy, okay, because it's just easier than saying milk, yogurt, cheese, and or alternatives. So the dairy food group includes milk, cheese, yogurt, and alternatives, but only when they're fortified with calcium. And this is really important because that food group provides one of the main nutrients is calcium in our diets. But it also includes flavored milk as a core food, but it doesn't include milkshakes made with ice cream or butter or cream. They're part of the discretionary category. And then obviously there's a discretionary. So everything that's not in that Australian Guide to Healthy Eating falls into that group, which most of us probably have way too much of that in our diet because it's easily accessible and available and it tastes good and we enjoy it. So one serve of discretionary food is not equal to 1 portion. So if you see here, for example, a pie would probably be about 3 DF serves. A cupcake, I guess depends on the size. A small cupcake could be 1, but then one of those large muffins you get at cafes, they're probably 3 or 4 discretionary serves a day. Now the allowance for discretionary foods for Australians, both kids and adults, is if you're overweight, you get nothing. Because that's meant to reduce your energy intake and you're meant to lose the weight. But if you are a healthy weight or you exercise and you have higher energy requirements for growth, then you get some allowance that ranges from up to 3 a day. So this is the results. So what did we actually find? Well, we found that, kids are eating vegetables. That's the good news. They actually are eating. 83% reported having vegetables on the day of the survey, but they're not consuming enough. So only 8% on that day of recall actually consumed enough vegetables, which in itself is good news because you don't have to work so hard to get them to eat it, but you probably have to work a bit harder to get them to eat more. So if you look at every single age and sex group, the median intake was well below the recommendations. Now, the only reason the 2 to 3-year-olds are actually closer to the recommendations is because their recommendations are a lot smaller. It's like 1 serve, right? And most kids are still eating at least 1 serve of vegetables a day. But you can see the requirements increase with age, but their intake pretty much stays the same for boys and girls. And their intake is more than 3 times below recommendations. So we really need to do something about vegetable intake among Australians. So hopefully this will make you guys eat your tomatoes at breakfast. So we also found that most children ate too much. So when I talked about those 3 serve recommendation, that's maximum. There are different ones for each age group and sex. But you can see again, for every age group and gender, pretty much every single child exceeded the recommendation, or at least more than half exceeded the recommendation, with most more than 70%. So this is what I guess 1 serve of discretionary food looks like, and 65% of kids overall had more than 3 serves a day. So, we have an issue there. So let's find out what we can do about it. We also classified veggie consumers as high or low, and this high or low relative, so it was based on their median intake, which is 1.2. Okay, so kids who had more than 1.2 and kids who had less than 1.2 serves of veggies, you can see the high consumers actually had more calories, more megajoules, but they had substantially lower discretionary kilojoules. So even though they were eating more, because they were higher veggie consumers, they actually had less discretionary calories in their diet, where low veggie consumers consumed less food, but they actually had a lot greater discretionary energy. So potentially increasing vegetable consumption can also help decrease discretionary consumption. And does that translate into any obesity markers? Well, it did as well. So we looked at risk of metabolic complications, and that's based on the waist to height ratio, which is a better measure of obesity in kids than just using BMI, because they're actually measuring their visceral obesity as well as relative to their height. So a cutoff of greater than 0.5 puts them at substantially increased risk, and less than 0.5 is not at risk. And you can see here that those who were low consumers were at an increased risk of metabolic complications, and those who were high consumers were not at an increased risk. So again, it actually did translate to some sort of anthropometric measures, but obviously it's a cross-sectional study, so it's not causal, but the association is quite consistent throughout, as you can see. So one of the key things I guess we want to recommend is to substitute these discretionary foods for core foods, because we're overeating here and undereating here, so let's balance that out a little bit. How do we balance? Well, we wanted to look at the eating occasions that contributed the most discretionary foods, and I can say that breakfast wasn't one of them. The first eating occasion reported was snack. So if someone called their eating occasion snack, it had the greatest percent energy from discretionary, which was 24%. And we've got the top 3 foods for each of these eating occasions up here on the board. But remember that morning tea, afternoon tea, beverage, which are also snacking occasions, weren't up there. So calling something snack was more likely to be discretionary than calling something morning tea or afternoon tea, which is quite interesting. So when kids have a snack, it tends to be discretionary. So we need to change that snack mentality to snack on something healthier. And then dinner, obviously dinner has the greatest food that's consumed, so it also had the greatest amount of discretionary, and it was 0.1% behind snack, so it's quite large as well. And you can see the top foods, potatoes, so these are discretionary potatoes, so it's pretty much your deep fried potatoes, sausages, and things like pizza and burgers. And then the next eating occasion was lunch. So the top 3 eating occasions contributed, more than 70% of discretionary. So these are the eating occasions that we want to target. And we can give some examples. We can add some veggies in the snacking occasions, things like yogurt, because we know that kids are falling short of that food group. And you can make some realistic substitutions for those foods that they're already consuming. So the key recommendation for today, the first one for you to take home, is that we need to decrease, discretionary intake. But let's make some smarter swaps. So if a child is having burgers and fries, I'm not going to say have an apple instead. You can tell them, have a burger that's made with lean meat, that has a wholemeal bread, and has potato wedges that are baked. So let's just get kids switching from discretionary foods to core foods. We also found, this is probably one of my most exciting slides, because I actually found this so interesting and it's a bit innovative. It hasn't been reported very much in the literature, is that so the greater the number of eating occasions that contained vegetables, so they either had 1, 2, 3 or more, the greater their veggie serves. So kids don't compensate. If you get them to have veggies at more than 1 eating occasion, their number of daily vegetable serves increases. So one of the recommendations from that is get kids to have veggies more than once a day, right? Because it was really clear, and it was like an exponential increase. It wasn't proportional to have, it wasn't, twice a day wasn't double, it was more than double, and then 3 times or nearly 4 times as much. And we also found that they have greater veggie variety, which is also very important in a diet. If you just have banana every single day, it's great, but you need to get nutrients from other types of fruits and from other types of vegetables. So kids who had 1 eating occasion had 1.1 serves of vegetable-dense food groups, then 2.1, and then 2.7. So there's greater variety, and probably one of the reasons for that is, for example, you might have tomato and mushrooms at breakfast, and you might have lettuce in your sandwich at lunch, or a side salad, and dinner might be roasted veggies. So the types of veggies consumed culturally are quite different at eating occasions, so by encouraging them to have more than 1 eating occasion will help with total serves and also help with the variety of vegetables in their diet. But, and this presentation is full of buts, but only 36% of kids had veggies more than twice a day. So really, they're already having veggies, they're not having enough, and if they have more, they have more frequently, they have more. So let's get kids to eat veggies more frequently. And that's the next recommendation that I have for you. And among those kids that had it more than once, so if they only had it at dinner once a day, it was pretty much a dinner. If they had it twice a day, it was at lunch and dinner. So let's focus on the lunch and maybe add more veggies to their sandwich, or give them lunch options that are a bit higher in vegetables. And so then we decided to look at, okay, which vegetable food group is the most popular? So what can we target as the recommendation? So if you look at all the food groups analyzed in the survey, the food group called mixed dishes, where cereal is the main ingredient. So the ABS likes to have very simple names for their food groups. That really translates to things like pizza, fried rice, pasta bakes, things that are predominantly grains but also have some veggies, followed by other fruiting vegetables, and that food group has things like avocado, cucumber, capsicum, and then potatoes, which is interesting because that's a singular food group, right? It's just one vegetable. So we decided to look at, well, what if we only look at food groups that are vegetable dense and see what the top ones are? So then if we do that, the percentage of consumers of mixed dishes really drops down to only 4% actually have that. And vegetable dense mixed dishes food groups, some examples are like a veggie lasagna or veggie fried rice, lentil burger, or salad sandwich. So 2 things from here. We can obviously get kids to eat more of the food groups, the vegetables that they are eating, like potatoes, and maybe have more variety, like sweet potato, or add some more veggies, like chopped tomatoes to a baked potato, or do a roast with more veggies, so potato, sweet potato, carrot, pumpkin. So we can add to what they're already eating, or we can add more veggies to the mixed dishes. So let's encourage more vegetables, potentially even in a spaghetti bolognese. Add extra mushrooms and carrot into the sauce and tomatoes and so on. So that's another recommendation that you can take home, is we need to increase the content of vegetables from mixed dishes because they were really popular. Kids were having it, but they weren't having mixed dishes that were really high in vegetables. So the key results in terms of the veggies, and next we'll move on to the milk, is that children had veggies, but obviously not enough. We know that having more veggies, relative, so not even that much more, just a bit more veggies, was really beneficial for the amount that they were consuming and also for variety, and it seems to potentially substitute those discretionary foods. And obviously having it more frequently resulted in greater serves and greater variety, and most veggies were consumed at dinner, so let's get kids to have it at lunch as well as dinner, and then once we get that, then we can talk about snacking potentially and also breakfast. So the next analysis that we did was looking at milk intake. Milk is the largest source of dairy in Australian kids' diets and the greatest source of calcium. And with that 90% of adolescent girls not getting enough calcium, we really wanted to investigate the major food source that are providing that calcium among children. So what is the problem? Well, we know that 4 in 5 kids aren't meeting their dairy targets, so that food group. Most adolescents aren't even close to calcium, and like I mentioned, calcium is so important for bone mass development and preventing osteoporosis later in life. So what can we learn from this analysis to get kids to meet those targets? Well, these are the things that are included in dairy. So it's milk, it's yogurt, it's cheese, and it's both flavored and non-flavored yogurts and flavored and non-flavored milks. It also includes milks like fortified evaporated milk, but it doesn't include condensed milk, for example. That's discretionary. It doesn't include butter, and it doesn't include cream. They all fall into the discretionary. That makes things taste good, and you shouldn't have it all the time. So bear with me here, because this is a little bit, you might have to stop eating and pay attention. This is where I explain the different food groups that we analyze, and once you got that, then everything will fall into place. So milk in our survey is dairy milk, as I mentioned previously. So a plain milk drinker is someone who actually drank plain milk. So you could either drink it, not drink it at all, or avoid it altogether. Okay? So among those that drank it, there are really 3 different types of milk you can drink. Plain, so exclusively drink plain, you don't drink anything else. You could drink flavored. So flavored is really plain milk with flavoring, which is we define as powder or a syrup. So it could be like cocoa powder added, like a prepared beverage like Milo, for example, or it could be sugar that you just added. Sugar is a powder, or it could be chocolate topping or caramel topping, anything that you've used to flavor the milk. But if you used, for example, fruit to flavor the milk, then it goes into the other beverage. Coffee we didn't look at coffee for kids because it's not a recommended beverage, so that's excluded. And flavored milk also included ready-to-drink flavored milks as well. So in other milk, you could either have other milk as a beverage, so that's your milkshakes and smoothies, and all the ones that didn't fit into flavored or plain definition, which includes quite a lot of discretionary. So if you have a smoothie or milkshake with ice cream, that's a discretionary food. Whereas most flavored milks are core and plain's core. And then a non-drinker meant they didn't have any milk drink beverage. They only had it with food. So for example, milk in your mashed potato or milk with your breakfast cereal. Okay, but it meant that they didn't drink it, whereas the other milk drinkers could have also had milk in breakfast cereal and so on. Then a milk avoider is pretty much they could have had anything else from that dairy food group, but they definitely didn't have milk. Is everyone still with me? Okay. So what did we find? Well, among the nearly 3,000 kids, we found that 81% were actually milk consumers. So you can see the story is very similar to before. Kids are having those food groups. It's still, 20% aren't. We can work on them too. But the vast majority are having them. So we need to get kids to have more of what they're actually having. And 51% were actually drinking milk. So again, drinking milk is the most popular thing among kids in terms of how they have it. And 31% were exclusively not drinking it, just having it on cereal or food. Then the most popular milk that kids had was plain milk, followed by flavored, followed by other milk, which is nice. It's nice that we didn't get other milk first, right? We got plain milk as the most popular. So plain and flavored milk drinkers also consume the most dairy serves. So the question was, if you drink it, does it mean that you're going to get more total dairy? And it did. So you can see total dairy is nearly 3 serves a day for these groups, and it really falls down to 1 for the other groups. When you look at the percentage meeting guidelines, you can see there's a huge difference. Kids who drank flavored or plain were more likely to meet dairy targets, And if you're a milk avoider, only 4% actually were. And that's because milk drinking drove total dairy. There was no significant difference in other dairy across all the groups. So plain milk, flavored, other milk drinkers and avoiders all had the same amount of cheese and yogurt in their diet. So you know that really milk is the main difference in meeting dairy targets. We also decided to look at calcium intake, likelihood of meeting calcium and iron. And the reason why we looked at iron is because some milks like Milo are fortified with iron, but also breakfast cereal from previous research we published makes a huge contribution to iron intake in kids' diets, and that's consumed with milk as well. So you can see both plain and flavored milk drinkers, if you look at the green, they're more likely to meet their calcium targets. But also flavored milk and other milk drinkers, other milk non-drinkers, so the ones that only had on cereal, were also more likely to meet their iron targets. And that's because 1 in 2 flavored milk in the survey that was consumed was fortified with iron. And with other milk non-drinkers, that's really coming from the breakfast cereal. So what's the recommendation? Really, you need to get kids to drink milk. You need to get them to drink more milk, potentially, to help meet both dairy and calcium targets. We also know, unfortunately, though, that milk intake decreases with age. So as you can see, the highest prevalence of milk consumption is among the younger kids, and that drops. And at the same time, milk avoidance increases with age. When you look at flavored milk consumers, the highest prevalence was among those aged 9 to 13. But what's interesting here is that in adolescents, which are the ones that aren't getting enough, that are avoiding the most milk or having the most other milk, it's the only age group where you had more flavored milk drinkers than plain milk drinkers. Okay, so keep that in mind as we continue on with the rest of the presentation. So the other thing we decided to look at, well, in terms of beverages, we know that adolescents from the survey are having a very high amount of sugar sweetened beverages, so we decided to look at what role does sugar sweetened beverages like soft drinks, cordials, energy drinks play in the diets relative to milk. And you can see here that the 2 groups that had the lowest sugar sweetened beverage intake were both flavored and plain milk, no difference between them. And the highest was among milk avoiders. That had the highest amount, followed by other milk drinkers. And at the same time, plain milk drinkers were the most likely to meet the WHO free sugars targets. And milk avoiders, consequently, had the greatest amount of sugar sweetened beverage intake, and both flavored and plain had the least amount. So the prevalence of consumers and the amount both translated. So the next recommendation we have is perhaps for adolescents, flavored milk may help overcome that. It's still a core food. We showed that flavored milk, but not other milk, so not your milkshakes and smoothies, they were the ones that still had the lower free sugars intake. They're least likely to consume sugar and sweetened beverages, but in that age group, they obviously like that sweet beverage, and it will help them meet their targets because they're not drinking plain milk otherwise. So very important. It's probably a really nice substitution when we talk about decreased discretionary foods. Switch that soft drink for flavored milk. So what are the key results from the milk intake? Well, we know that children consume milk, and predominantly it was as a beverage. We know that milk consumption, both plain and total milk, decreased with age, so we need to target those adolescents a bit more. We know that both plain and flavored milk consumers had greater total milk and greater total dairy, which was purely driven by their milk intake. And we know that both plain and flavored milk had the highest nutrient intakes, with the exception that flavored milk actually had higher iron intake than the other groups, whereas plain milk didn't. And also plain milk drinkers were the most likely to meet the free sugars targets because they were the least likely to consume sugar sweetened beverages. So what does this all mean? Now that you guys are all staring at me and done your breakfast, perfect timing. So for veggies, well, we're going to increase vegetable intake. How are we going to increase it? We're going to have them more often. So who's going to be thinking about their veggies at lunch today? Hopefully some people, yeah. So just think about yourself too, because if we don't change our diets, there's no way we can change kids' diets, right? We have to be role models and show them that you can have veggies as part of breakfast, lunch, dinner, or snacks. We want to have them at lunch and at dinner. We're already having it at dinner. We need to have probably more at dinner, but also get kids to have some veggies at lunch. So those of you who have kids, start thinking about packing some more veggies in their lunch. And I guess starting to get kids to eat veggies starts from when you introduce solids, and also even during pregnancy. So it's really important that we get that message across, especially to new moms. Being a new mom, I've experienced it. Lucky I have the background to do it. But you can get kids to eat veggies. You gotta have them while pregnant because it changes their taste perceptions in utero. And then once you start introducing breastfeeding, keep eating it because they're getting the flavor. And then when you introduce solids, you start introducing lots of veggies pretty much before you want to introduce any other fruit, because kids have that innate preference for sweet foods. So it's really important that we start from before they're even born to get them to eat veggies. And obviously, as role models, that everyone in the room can eat vegetables as well. And we need to start substituting some of those discretionary foods for those that aren't discretionary. Especially things like French fries have baked potatoes. And obviously, by doing that, we're probably going to help decrease discretionary intake, which hopefully will help with the obesity epidemic. And for milk, we really want kids just to drink milk, just encourage them, especially as they age. We need to get them to keep drinking milk. You can choose either plain or flavored, and the evidence is quite strong there now that they're both just as good as each other. Obviously, you choose a flavored milk that has the least sugars that the child likes, that will still get them to drink their milk. And you consider obviously a plain or flavored milk beverage as an alternative to sugar-sweetened beverage, especially among adolescents who are the highest consumers of sugar and sweetened beverages, and they're more consumers of flavor than plain, and they're the least likely to consume milk. And thank you very much. So I'd like to also thank my team, Tim, Andy, Kate, and Peter, which also there's the stats and the analysis and the work that goes behind this. It's not a one-person job. So thank you very much. Good questions now or later? Yeah, okay. So does anyone have any questions?
It's a flavoured milk. Talking about like lower sugar, so it's talking more about like the added in the
I think in order to align, flavored milk is still a core food group irrespective of the sugar, but as part of the guidelines it also says limit added sugars. So if you're choosing a flavored milk, I think it's important, if it's ready to drink, to choose one that has the least sugar so you get more bang for your buck. And also if you're making like sugar and milk as flavored milk as well, which is still flavored milk for kids, then minimize the amount that you add, right? But I guess with Milo, I'd say, do as per the recommended serve. Yeah.
And is that like, would the flavoured milk be less sugar content than ice cream?
Oh yeah, usually. I guess it depends on what's available, but I would say most likely, yeah. And it's not a discretionary food, whereas ice cream is. And ice cream has almost no calcium, and it's high in saturated fat and other things that we want to limit or swap in our diets, right?
Noticing a lot of adults going to have coffee, and I think a lot of the children are
No, so baby chinos are just milk, like frothed milk. It doesn't have any coffee.
So where does that fit into that?
So that would be captured as part of their milk intake. But it would be great if the survey actually asked, like, what do you call that food? So we can capture how much the impact of baby chinos on kids' milk intake. It'd be interesting.
I'm glad you made one comment about pregnancy and breastfeeding. That's where it starts.
Yeah. Yeah, I think and food preferences, I think it's really important to start, obviously, during pregnancy, to start eating the foods. Even if you don't like it, just eat it so you can expose your child to those flavors. Because vegetables, most of them are bitter, right? So you need to get them used to those flavor profiles so they actually enjoy eating it later in life. And being role models, I think it's really important for nurses, for parents, for doctors, for anyone working with kids, to actually see it. Like they have to see it. If they don't see it, they're not going to copy it. Yeah. Anything else? Oh yeah.
I think the touch on in schools supporting the red days and green days, one children too old. Is that likely comes with children actually using better food?
I'm not too familiar with the research which shows the impact of that. I don't know if any of you guys know if there's any done on the impact of the school canteen red and amber days on kids' intakes. I would say it probably, limiting access, I guess, would probably do something in terms of affect their intake. But I think a lot happens at home too. So it's important to look at the totality of the diet, the whole day, and get kids to eat better. Yeah. But I'm sure if you're limiting discretionary foods at school, to some extent, it will impact their intake. Yeah.
We might leave the rest of the questions then. We should have some more time at the end if you have any more others.
Perfect. Thank you very much.
Move down a little bit because Flavia is quite a bit taller than I am. So this morning I just wanted to paint a little bit of a picture around why we're eating what we are, with a particular focus on dairy food. So we heard that the nation's not doing a great job in terms of nutrition, so trying to unpick a few of those consumer insights. So I work for Dairy Australia, so just a bit of background for those who don't know who we are. We're the national services body for the dairy industry, so our job is really to drive improved profitability and sustainability for Australian dairy farmers. So I work as part of the health and nutrition team there. So we work to communicate the latest evidence around health and nutrition and of course dairy. So I'm lucky enough to work with a team of other qualified nutrition professionals across the areas of nutrition science, nutrition policy and regulation, and also we work with our consumer marketing team really closely. So this morning I just wanted to talk through a collection of insights that we have at DA. So some from our Dairy Monitor community tracking, which is our consumer tracking, so we've been doing this for almost 10 years now, and also some other insights that we've collected as well. So we know that our Australian dietary guidelines are our best and most trusted source of nutrition information. They're developed by both the government and by experts and based on over 55,000 pieces of information, so it's a great document. So we know we should be eating foods in line with each of those 5 food groups. So having our whole grain cereals and milk for breakfast, snacking on things like fruit and yogurt throughout the day, getting in our 5 serves of veg, and then having that lean piece of protein for dinner. So that all does sound pretty easy and straightforward, but as Flavia pointed out, we're really not doing a very good job as a nation when it comes to nutrition, unfortunately. So this is some data from 2 to 18-year-olds, so not just children, but the entire population, about how we're going when it comes to our serves. So veg and dairy are our top 2 under-consumed food groups. When we hear about healthy eating, I think it's really ingrained in consumers' minds to have 5 serves of veg and your 2 serves of fruit. But what's really important is that we actually focus on each of those 5 food groups because they're all important when it comes to a healthy, balanced diet. So I guess the question is, how did we get so off track when it comes to our diet? We know that good nutrition is so important across the entire lifespan, and particularly for children and teenagers, excuse me, when they're in that most crucial stage of growth and development. So we've collected some data around how important consumers rate each of the 5 food groups. And what we've been seeing is that it's just dropping and dropping over the years. So people just aren't seeing that the 5 food groups are important anymore. And this goes for both adults and children. What we also know is that dairy foods are actually rated as the least important food groups by adults and children. Mums do see the benefit for children more than themselves, which is quite interesting. But as Flavia pointed out, we're still nowhere near meeting the recommendations that we should be. So this data is really interesting because when it comes to key food issues, we're really aware of healthiness. So we're seeing things, we're hearing things, or reading things about healthiness. So it's everywhere and we are aware of it. But I guess messages about healthiness and nutrition can come in a number of different ways. So the issue is there's just so much conflicting nutrition information out there, and it's not always evidence-based, unfortunately. So everyone thinks they're an expert, Bob next door thinks he's an expert. The people on Instagram are all promoting the latest diet or trend. We've got Paleo Pete who goes on TV and frustrates all of us, unfortunately. So when we look at what's trending in the world of health and nutrition, people don't say it's the dietary guidelines, they're not cool, they're not trendy. And I think families are really just trying to do the best for themselves, but it's really quite a confusing nutrition environment out there. So I do really feel for people and their families. We know that dieting is still really prevalent in the population. So in our survey last year, there were about 44% of people who went on a diet to improve health or for weight loss in the last 12 months. And we know that fat and sugar are still seen as the baddies. And dairy foods are also implicated in those dietary choices, so people following a lactose-free diet or a paleo diet. We know that this limiting mindset is mainstream, so there are about 2/3 of people who made a conscious choice to limit foods that they didn't think were part of a healthy diet. So that's great. That message about sugar-sweetened beverages is getting through. We're seeing about 2/3 of people wanting to reduce those. But perhaps the message isn't quite getting through for those other discretionary foods as well. So things like chocolate and your alcohol, chips. And I guess the question is, we're limiting these foods, but what are we replacing these with? Are we making a conscious effort to increasing those core or 5 food group foods? The rise of alternatives is an interesting one. So it used to go to the dairy fridge and your only choice was it full fat or is it low fat? But now, in the face of plant-based diets, we've got the vegan activists out there. There's just dozens of choices to conventional cow's milk now. So you see beverages made from soy, from peas, from nuts. So there's really quite a choice out there for consumers. And what we know now is that there's about 1/3 of people who consume alternatives. So this data is really interesting. So we know that milk sales are greatest overall, so we're selling more milk than alternatives, which is great. But in terms of how quickly that increase is, in the last 2 years, so 2014 to 2016, there was a 20% increase in supermarket sales of alternatives, and that was compared to 4% of milk. And what's important is this is just supermarket sales, so it's not actually taking into account what's sold in cafes. So you can imagine that volume growth would actually be quite a lot higher. So who are buying alternatives and why? They're predominantly 18 to 35-year-old women. Although they're not the biggest purchasers, women aged 50 plus tend to buy those on behalf of another family member, so their children or their husband. So they're a really important influencer of consumption. There's over half of people that think these are a healthier option, so that's why they buy those. 1/3 prefer the taste, and 17% that they have a dairy intolerance or allergy. So the way these products are marketed, and then the huge amount of confusion and misinformation is out there, combined to create this effect where consumers see choosing these alternatives as a bit of a shortcut to health. So it's a little bit of a paradox. So in this world where we see people wanting to move more to naturalness or more to a whole food approach, we look at the ingredients that are in some of these alternatives, and it is a bit of a paradox when you can compare them just to milk that has one ingredient and then these others that have quite a few other things that are added to them. Of course, some people might go and make their own almond milk, but I'm sure that's quite a small portion of the population. So we see people reporting that they think they can easily get other vitamins and minerals from other sources, but in just focusing on alternatives, a lot of the vitamins and minerals are actually added back to these foods in an attempt to mimic the composition of cow's milk. So the calcium, you might flip over the packet and have a look. So the calcium might be equivalent, but it might not be as bioavailable as from the natural source. In terms of protein, the alternatives are generally a little bit less. Soy is actually not too bad, but the quality might actually be a little bit different. The price is something that may or may not matter to certain demographics, but in terms of nutrient bang for your buck, then regular cow's milk comes out on top. The evidence is starting to grow a little bit around alternatives, so there's some emerging concerns around iodine deficiency if you're replacing those and swapping them out for cow's milk, and also around growth and development of kids. I was having a chat to Flavia the other day. She said some mums in her mother's group were taking a cow's milk and giving them almond milk instead, so little kids who are only 1, so it's a bit of a concern at the moment. So focusing in on dairy foods a little bit, the evidence is really great for the benefits of all dairy foods in the diet. So by all dairy foods, I mean all varieties of milk, cheese and yogurt. So that's regular fat, reduced fat, plain and flavoured varieties. We know that adequate consumption is associated with a reduced risk of things like stroke, hypertension, some types of cancers, type 2 diabetes, and not associated with weight gain as well, which is a very good one. But despite these health benefits, some health professionals will still recommend limiting dairy in the diet. I think they focus a lot on, it's high in saturated fat or it's high in sodium. But dairy foods are this really unique package of nutrients. So I think everyone knows that dairy foods are a really great source of calcium and great for bone health. But they contain a lot of other different nutrients in there. So these all work together synergistically, together with these other bioactive components to give the health benefits that they do. So despite these benefits, we know there's still about a quarter of the population that question having dairy in the diet. So they've got doubts or concerns, they don't want to consume it, or they just don't believe it's essential for a healthy diet. So that leads to reduced intake, or others that are just considering reducing consumption because of those doubts. The general approach to dairy foods for adults, it's not I try and make sure I consume dairy every day, but again, it's you're not paying attention or trying to limit the consumption of dairy in the diet, or just completely avoiding it altogether. I mentioned earlier there's this limiting mindset in consumers, and we're still seeing that with dairy. So it's almost like in the back of consumers' minds, I think if we limit dairy, it's a bit of a shortcut to health, so moderating is the better way to go than trying to have enough. What we're also seeing is that there's a greater proportion of younger women consuming less white milk. And mums with kids aged 5 to 12 are consuming less white milk at a more rapid rate compared to any other subgroup. So that's quite interesting, because that may then have a bit of a flow-on effect to the rest of the household. So we know there's this limiting or avoiding behaviour going on, but what are the reasons why? So in last year's survey, we saw those more traditional barriers, like I'm watching my weight, still up there. Reasons around like saturated fat and cholesterol have tended to drop over the last couple of years, but in the current environment, obviously other ones will start taking their place. So now we're seeing issues like dairy makes me feel bloated, dairy gives me a stomach upset, or dairy foods just don't agree with me. So really this digestive problem is coming through. Interestingly, the reasons for limiting each product are quite different. So for white milk, it's people just wanting to cut it out, they're moving to alternatives on a diet or trying to lose weight. In terms of cheese, people are worried about the fat content of cheese. And for yogurt, it's the price, which I think is quite interesting, or they think there's too much sugar in it. So that approach for limiting is quite different from product to product. We did some work earlier this year around areas of concern. So it's around people wondering about the healthiness of dairy in the diet, animal welfare issues, allergies and intolerance, etc. But I think at the end of the day, consumers just want a bit of transparency. They just want to know what's in my milk, what are we doing to help the environment. So I think as long as those concerns are addressed, then I think we might be seeing some of those behaviours change a little bit. So we know consumers feel that there's just too much information out there that they actually just don't feel informed anymore. So in the current environment, I think that's really applicable. There is just so much out there, and I do understand why people are so confused. The good news is that consumers trust health professionals. So they're a really credible source of information when it comes to food issues. So that's really promising that we're seeing like health experts ahead of people like journalists, celebrities, your next door neighbour, so that's quite promising. We know that health professionals are speaking about dairy foods, so about 10% of messages come from HPs. The good news is that they are mostly quite positive, so they're recognising the traditional benefits of dairy in the diet. But there is a percentage of negative messages in there, so people telling their patients to limit dairy, it's not good because it's high in fat, cholesterol, those sorts of issues. So it's really time to provide that clarity and a really good enough reason to consume these things, particularly in the current environment when we're just seeing some of those traditional benefits dropping and people just not believing that dairy food is essential anymore. So this is what my idea would look like. We've had multiple voices, consistent evidence-based messages, all based on the Australian Dietary Guidelines, which would be fantastic, but unfortunately we know that's not quite the case at the moment. At DA, we do just try and play our small part by providing some evidence-based information, like the flavoured milk position paper that you'll find on your tables. And so just to quickly summarise, we know that consumers and their families are really confused about what constitutes a healthy diet. Milk, cheese and yogurt are core, or what we call 5 food group foods, but many just have this mindset of limiting or avoiding them. We know that reduced dairy intake is largely driven by fad diets, and now consumers believing that alternatives are healthier. But the great news is that health professionals are trusted, and they do have that ability to provide some information in line with the ADGs. Well, so thank you for coming out early this morning. We really appreciate it.